Okay, Dr. Ray here, Vet Triage. We are continuing through this November 2024 edition of Veterinary Surgery. More dogs. This is another case report. I think a fairly silly one, but you guys can be the judge. Surgical treatment of traumatic nasal avulsion in a brachycephalic dog. This case comes out of Washington State University Vet School. So these case reports are good for interns and residents to learn about the prior medical history. Is a good summary, and also adds another new technique or something that you can add. You can answer questions at an exam, like your board exam. Otherwise, they're not really that useful for the grand scheme of things. This case especially, just doesn't resonate with me. Kind of silly, but here we go. Objective is to describe the successful treatment of traumatic nasal avulsion injury resulting in dynamic nasal stenosis and retroventral deviation of the nasal cartilage, 6-year-old female pug. The initial surgical intervention involved facial reconstructive surgery to repair a maxillary lip avulsion following diagnosis of stenosis in both common nasal meatises, resulting in respiratory distress. After the initial surgery, balloon dilatation of the nasal passages and rhinoplasty were additionally performed. 10 weeks after the traumatic event, the diagnosis of dynamic nasal stenosis and rostroventral nasal cartilage deviation, secondary to dorsal and lateral nasal ligament injuries, was made obvious, and so balloon dilatation was repeated, along with nasal skin fold resection and realignment of the nasal passages. Along with, stabilization of nasal alignment, the dorsal and lateral nasal ligaments were reconstructed to stabilize the alignment. That's the part of this I think is pretty cool. We'll show you a picture of it in a minute. Bilateral temporary endonasal stents were inserted into the nasal meatises to maintain alignment and patency of the dilated passage during recovery. And so these are the stents they put into this dog's face. Results: no complications. The stents were removed 4 weeks after placement. 8-month recovery was good, and the conclusion was that traumatic nasal avulsion injury can be treated this way in a brachycephalic dog. Introduction. Nasal stenosis is a condition in which there is a narrowing within the nasal canal, nasal cavity. The stenosis can be categorized as either congenital, meaning present at birth, or acquired, meaning they developed it after birth. The congenital version is more common with brachycephalic breeds associated with stenotic nares, aberrant nasal turbinates, and mucoid cysts. You can watch my lectures. I have many lectures on this topic in my YouTube channel. Acquired nasal stenosis is usually associated with abnormal tissue thickening due to inflammatory conditions like upper airway infections, space-occupying lesions like neoplasia, nasal planum vasculopathy, secondary to surgical interventions that result in stenosis or strictures, vomiting or gastrointestinal reflux, or trauma. Clinical signs arise from upper respiratory tract obstruction due to lack of nasal airflow, resulting in inspiratory stridor and stridor, open mouth breathing, gagging, sneezing, sleep disordered breathing, and obstructive sleep apnea, heat intolerance, chronic nasal discharge. Treatment focuses on restoring airflow through the nares while minimizing risk of stenosis. Interventions to improve airflow within nasal passages include rhinoplasty, turbinectomy, surgical resection, balloon dilatation, and placement of endonasal stents. Ventral deviation or drooping of the nasal cartilage is known as a potential complication following rostral maxillectomy, resulting in obstruction of airflow through the common nasal meatus. Ventral deviation of the nasal cartilage due to avulsion injuries of the dorsal and lateral nasal ligaments has not been reported. So for this dog, just a summary of the procedures: a right nasal maxillary lip laceration and an oronasal fistula. Nares were mildly stenotic. They performed a CT of the head. Deviation of the nasal cartilage with no skull fractures or nasal stenosis present. Then the first surgery was facial soft tissue reconstruction and nasal avulsion injury, and that's the pictures you have there. So in the pictures in A and B, so you see there A and B, there's asymmetry of the rostral maxillary nose with marked right-sided soft tissue swelling of the bridge of nose and lip. The right maxillary lip avulsion and the defect shown by the white arrow. That's in picture C. And then 2 centimeter mucosal avulsion of the right maxillary buccal mucosa from the maxillary gingiva forming oronasal fistula. It's a black arrow. We're now in I think they mix up these letters. C, the white arrow, looks like the oronasal fistula, and B with the black arrow looks like the maxillary lip avulsion. So they messed up the symbols there. Bad vet surgery, bad. The endonasal stents in D and E were secured to the lip with sutures and were removed 2 days postoperatively after intraoral reconstruction. And the reconstruction is in F. All right. Another surgery, the second time, balloon dilatation and rhinoplasty for nasal stenosis. Laryngeal exam and a head CT. The CT found bilateral focal stenosis mid-nasal cavity at the level of the caudal end of the nasal cartilage. Although the nasal cartilage remained laterally deviated, the ventrolateral deviation had improved compared to the last CT. Balloon dilatation for nasal stenosis was recommended, and rhinoplasty to improve airflow. They performed a modified Trader's technique to resect both dorsolateral nasal cartilages using a diode laser. So I'm going to show you here the CT images, and then I'll describe them. So take a look at that. So what we're seeing here, and then I'll show you again, in figures A through C, the CT scan was consistent with avulsion of the soft tissue structures of the right maxilla and oronasal fistula, located caudal to the canine tooth, which is the white arrow, and the left ventral lateral deviation of nasal cartilage, which is dotted circles within the nasal passage, which was intact. And then D through F, second CT showing focal stenosis of mid-nasal cavity, level caudal end of nasal cartilage, white arrowheads, and relatively improved ventrolateral deviation. And then finally G through I, an esophageal balloon catheter advanced over the wire and inflated under fluoroscopy. 10 atmospheric pressure, focal nasal stenosis can be seen, black arrow. So you can especially see in that bottom row there, the fluoroscopy, G through I, that where the black arrow is showing that with the balloon it dilated the nasal cavity. So pretty cool. All right. Then the third surgery, realignment and stabilization of nasal cartilage, nasal fold resection, balloon dilatation, endonasal stem placement for dynamic nasal stenosis and rostroventral deviation of nasal cartilage. So 8 weeks after the second surgery, the dog's nose was visually elongated and had a dropped nose. So this is the picture here. I mean, you know, I'm not that convinced, but whatever. Right there. So the very first picture on this side is showing a dropped nose, and then their subsequent repair going from this side to this side. So after surgery, the length of the dog's muzzle was noticeably shorter compared to preoperative, and the dog had good tolerance to endonasal stents. The diagnosis of bilateral dynamic nasal stenosis and rostroventral deviation of the nasal cartilage caused by traumatic dorsal and lateral nasal ligament injuries was made. Balloon dilatation was performed, reconstructive surgery, bilateral endonasal stents, and then follow-up. The dog died 2 years after the last surgery from severe bronchitis, but the dog was doing great up until then. Was even sleeping without snoring and had normal breathing. I'll show you a picture of the part that I thought was pretty cool with regards to the ligaments there. There's a drawing of what they did from A through F. So you see they made an incision over the nasal cavity, they tightened up the ligaments and brought the nose back up. It's kind of cool. And then placed the endonasal stents in there to prevent stenosis. So in A, visually elongated and dropped nose. B, 4 centimeter full thickness skin incision over the bridge of the nose, caudal maxilla. C, 3 holes made parallel to each other with suture passed through the holes and anchored rostrally through the dorsolateral nasal cartilage in an interrupted vertical mattress suture pattern as prosthesis of the 3 nasal ligaments. And then D and E, nasal alignment was stabilized by adjusting the angle and tension of the sutures. Bilateral endonasal stents were placed in F. Discussion: traumatic nasal stenosis is rare in dogs and mostly being congenital. Brachycephalic dogs like pugs have stenotic nares within the context of brachycephalic obstructive airway syndrome, which you can look at my channel for videos on that. The majority of acquired nasal stenosis in dogs occurs within the nasopharyngeal region and are only rarely reported secondary to trauma. Rhinoplasty and turbinectomy are commonly performed to treat stenotic nares and aberrant nasal turbinates as a part of surgical treatment for brachycephalic obstructive airway syndrome. Video rhinoscopy could have been used here as well. The negative pressure within the nasal passages led to the dynamic collapse of the bridge of the nose due to the absence of ligamentous support to the nasal cartilage. In dogs, there are 3 nasal ligaments composed of the single dorsal nasal ligament and paired lateral nasal ligaments, one on each side. and attach the mobile part of the nose to the dorsal portion of the osseous nose. During inspiration, the redundant, unsupported nasal fold dynamically collapsed, causing airway obstruction. Endonasal stent placement is a temporary silicone endonasal stent placed to prevent abnormal scarring and stenosis in dogs with erosive and ulcerative vasculopathy of the nasal planum. Temporary silicone stents have been used to support a cylindrical mucosal graft in a dog to restore nasal patency due to secondary stenosis after initial maxillary surgery. In summary, the combined approach involving balloon dilatation for nasal stenosis, nasal realignment with the use of endonasal stents, resection of the redundant nasal fold, and reconstruction of the dorsal and lateral nasal ligaments yielded a favorable outcome in this dog. Nasal trauma with nasal ligamentous injury can lead to dynamic nasal stenosis secondarily and deviation or drooping of the nasal cartilage unless it's fixed. Balloon dilatation is minimally invasive that can help with stenosis, but it requires a supplementary surgical intervention to address the excessive nasal folds in these dogs. It's advisable to keep the stents in for several weeks following the procedure to limit the likelihood of stenosis development. In the author's opinion, primary repair of the nasal ligament was the most important part in achieving a successful long-term resolution of this dog's clinical signs. So again, it's cool. It's a cool paper, cool report, but I don't know. It doesn't really do much for me because you're kind of just sort of catching up with the disease. It's an unusual case, and so you're just sort of playing catch up every time things happen. You're trying to figure out another reason, how to treat things. So anyway, we'll see you guys again in the next video. Thanks so much for watching. Bye-bye.